Such a high-profile incident highlights the need for knowing how to save a life. News 19's Crystal Flintrop spoke with experts today about why everyone should have CPR and AED training.
This could happen out wherever we are in life, in the malls, anywhere, in schools, at work.
Cardiac arrest is a medical emergency where the heart doesn't work properly.
Cardiac arrest is when the heart's not able to fulfill its duties and pump blood, especially oxygenated blood, around the body so it can get to critical areas.
According to the National Heart, Lung, and Blood Institute, 9 out of 10 people who have a cardiac arrest outside of a hospital often die within minutes. But administering CPR may just save their life.
CPR is what keeps people alive. And what CPR does is it keeps blood moving through the body and most importantly through the brain. So as people's heart isn't beating, their brain is still getting blood, so it's still perfusing, and their brain tissue isn't dying.
Ellis says there are 3 things to remember when doing CPR.
The most important thing to remember is you're not going to hurt them. The general slogan is push hard, fast, and deep. We're trained to push about 100 to 110 times a minute, generally 2 inches deep on an adult. Now we also do rescue breathing and ventilations with our equipment, but if you're not comfortable doing that in the public setting, at least push on their chest.
CPR should be done until an automatic external defibrillator, or AED, can be used on the patient.
If that device notes that the patient is not having a good rhythm and they're in this ventricular fibrillation, the machine will tell you shock the heart and the machine will shock. What you're trying to do is electrically restart the heart so that it goes back into its normal rhythm.
In any medical emergency, people should call 911, where they will receive verbal directions on how to help the injured person. In La Crosse, I'm Crystal Flintrop, News 19.
Some good things to keep in mind there. Now, the American Heart Association notes that about 350,000 Americans die from cardiac arrest each year, and only about 46% of people who suffer one get the help they need before emergency responders arrive.